High value action number 6. And we actually saw a reference to this on one of the previous slides, but we're looking at well child visits and perinatal care. And part of the reason we're doing this, again, is that we've got specific HEDIS and CAHPS measures are where we're going to focus this time. But we also know that there is such a long tail to people not getting well child visits in those first 30 months of life, as well as perinatal care during mom's pregnancy. So some of the stats here, especially with regard to cardiovascular events, can be a really devastating cause of maternal mortality. Trying to get into the prevention of some of these things that we know are then going to have a very long tail cost, as well as just a terrible experience for our membership should some of these things go neglected. The other piece of this is you never have a second chance to make a first impression. If we've really engaged members in a human way across a pregnancy and then early in that child's development, that is a really rock solid place to look at low attrition and having someone sort of have that member for life mentality, because we've always done it this way and it's always been great care for my children. That's a plan and a brand that I'm probably going to have a really strong association with. So that's kind of the soft side of it. But as we look at, again, some of those HEDIS and CAHPS measures, we can specifically say on the HEDIS side, for example, that a well child visit within the first 15 months, and then a well child visit in 15 to 30 months, those are specifically going to be questions that are asked when we think about that overall HEDIS score. So when I start to put pen to paper on a correspondence, and it's why are we doing this? We know the business reason why this is an important measure to push. Similar, I'm sharing some of the CAHPS survey questions on, was it easy to get necessary care, test, treatment for my child? We can write our correspondence right back into that question. And we know that when that member is presented with that question, if they are someone who ends up taking a CAHPS survey, that not only have we provided the care that supports that, but we've also communicated around, we're specifically trying to help you here. So getting more into that usually and always response, as opposed to that never or sometimes response. Big dollars doing that over hundreds of thousands of people and doing that over the course of the year. So if there are any parents on the line here, you can imagine receiving this, call it your enrollment kit, or receiving a letter or receiving an EOB when you're in that family planning stage, or when your family's in the middle of a pregnancy, and what might be valuable to you. So one that I really like to start with here is that sense of endowment of there is already a whole suite of resources here for you. And they're sort of yours for the taking. And so there's no ask, there's really starting with a give. Another I like to point out on this slide is the literacy level. We know that many people may not have been active participants in their care for themselves as an adult. But when there is a forthcoming child, or when they are new parents, there's suddenly a different sense of wanting to be involved for the sake of that child. And so making sure that folks who have either never been engaged in the healthcare system, which can be correlated with literacy, making sure we are especially conscious of meeting them where they are, can be a really nice opportunity when we're focused on perinatal and well child. Similar with peer pressure, there are so many opportunities where we look at other moms are doing this and the results coming out of that. I mean, the stats just around the well child checks, I think, could be really great content in some of these correspondence to say this is kind of the way to go. This is how all new moms feel, and this is the resource that we can apply with that. But it sort of creates even a sense of community out of that peer pressure. And finally, one-to-many value. So knowing that at least we have sort of two constituents here, but oftentimes this can be a way to bring an entire sort of roster of dependents under a subscriber into the healthcare system and to getting sort of better value for their health plan membership.